Welcome to this presentation by the South Warwickshire Foundation Trust Physiotherapy team. Today we're going to talk about the benefits of exercise and how this relates to pulmonary rehabilitation. You may be watching this thinking, I can't exercise because exercising makes me breathless. In this video, we will discuss why anyone, even someone struggling with severe breathlessness, can benefit from exercise, and why breathlessness does not have to be feared. Breathlessness can make it difficult for us to do some of the activities we do usually, which can then lead to us doing less of them. This can make us lose some of our muscle strength and fitness and become even more breathless than we were to begin with. The original reason for being short of breath may have been your breathing condition, but it is then added to by reduced fitness and strength. Exercise can help to break the negative cycle of breathlessness shown here. If we exercise, we can instead improve our fitness, our strength, improve our energy levels and take on more activities. Our improved fitness means we can do more before becoming breathless. Before starting exercising in pulmonary rehab, you will have an appointment with a member of staff who will check your oxygen levels when you are breathless and help you to increase your confidence in feeling short of breath. In most situations, feeling short of breath is not dangerous and does not need to be feared. The shortness of breath we feel when we exercise is a natural reaction in our bodies to allow the lungs to take in more oxygen for our working muscles and is part of keeping our bodies fit and strong. Exercise can help to reverse muscle deconditioning and increase our strength. This can improve the performance of our heart and lungs and our overall physical capabilities, so that when we perform normal daily activities such as dressing or shopping, we feel less tired and are able to do more. In the long run, exercise can actually reduce our breathlessness when we're at rest or performing daily activities. Now we're going to talk about the main types of exercise, which are cardiovascular endurance, muscular strengthening, muscular endurance, and flexibility. These are all important components of exercise, but we're going to focus on the first three on screen today, as these are our focuses in pulmonary rehabilitation. Cardiovascular endurance is the ability of the heart and lungs to work together to provide the needed oxygen and fuel to the body during sustained physical activity. Examples would be marching on the spot, walking, jogging, and bike riding. We can improve our cardiovascular endurance by exercising at the right level for increasing periods of time. Improvements in endurance may, for example, mean you can walk for longer before having to stop for a rest. For maximum benefit, you should aim to engage in cardiovascular activities 3 to 4 times per week. Muscular strength is the amount of force a muscle can produce. We can improve our muscular strength by making our muscles work against a weight or a force. For example, climbing the stairs or moving from sitting to standing all involve strength. It's important for people with lung conditions to improve or maintain their muscular strength, since stronger and fitter muscles use oxygen more efficiently. This places less demand on our lungs to take in oxygen to supply our muscles, and so can reduce breathlessness. It's also very important to maintain our muscular strength as we age, because we lose muscle mass as we get older, which can lead to reduced mobility, balance issues, and falls. People with respiratory illness are unfortunately more prone to experience this, but we can counteract it by keeping strong or building our strength with regular exercise. It is recommended that muscle strengthening activities are completed on 2 or more days per week in addition to your aerobic activity total, and that all major muscle groups should be worked, including legs, arms, back, abdomen, and the chest. Muscular endurance is the ability of a muscle or a group of muscles to repeatedly perform an exercise against a force for an extended period of time. Examples of muscular endurance would be activities that require repetitive movements, such as high-repetition weightlifting, running, cycling, or rowing. Activities that increase muscular endurance, such as lifting weights, walking, and running, also help to increase cardiovascular endurance. The greater muscle endurance a person has, the longer he or she can work without fatigue or failure. There are many different types of exercise that are all effective in increasing our strength and fitness, such as all of the examples on screen. Any activity that gets the body moving can be classed as exercise, so there are lots of choices out there for everyone. The most important thing is to find something that you enjoy so that you are likely to continue it in the long term. There are countless benefits of exercising and being fitter. The heart gets stronger, the heart rate decreases and blood is pumped more efficiently around the body so that the blood pressure is better controlled. The lungs ventilate more effectively, improving oxygen delivery to the rest of the body, and better ventilation can also help with sputum clearance. Exercising releases feel-good hormones in the brain called endorphins, which are very important for our mental health. Weight-bearing or strength exercise improves our bone density and can reduce the risk of osteoporosis. The metabolism can also improve, which helps to burn fat and control weight. Even our sleep can be improved by exercising, and these are just a few of the many benefits of being fitter. The Borg scale of breathlessness is something that we use a lot in pulmonary rehab, and it can be used to guide us when we are exercising to ensure that we are working at the ideal level. During exercise, working at a level of 3 to 4, or moderate to somewhat severe breathlessness, is ideal. At this level, breathlessness is increased sufficiently to challenge the heart and lungs to work harder and to improve our endurance. Working at a lower level of breathlessness would not necessarily lead to changes in our body, whilst working at a higher level on the scale may use more energy than is necessary to improve endurance and may be hard to keep up over time. Remember that it is normal to get breathless when you are active or exercising. Remember to stay calm and control your breathing. Staying motivated is the key to making exercise successful. We can stay focused by making exercise enjoyable. Make it personal. There are many different types of exercise and people enjoy different things. Setting goals can also be really helpful. Again, make these personal to you. Perhaps you want to be able to climb the stairs without being breathless. Maybe you want to complete the shopping or play with your grandchildren. Setting these goals will help you to keep in mind what you are exercising for. Even better, share these goals with your friends and family so that you have their help and support. Giving yourself a reward after reaching certain milestones may also help to keep you motivated. To make exercise successful, it's also important to identify and avoid using excuses. It's useful to keep in mind that exercise is just as important as other jobs or daily tasks. Keep in mind your exercise goals and try and prioritise and plan exercise into your day. For example, a 30-minute workout is just 2% of your day. Try to prioritise meeting your goals and avoid using excuses. Here are some tips to make sure you are exercising effectively. Perform exercise regularly and often so that it can easily be incorporated into your daily routine and so that it's not too tiring. Begin gently and progress gradually. Don't be tempted to do too much too soon. Make sure to warm up and cool down and avoid extremes of temperature. Drink plenty of water and wait for at least an hour after eating before you exercise. Wear loose, comfortable clothing and supportive shoes. Non-slip shoes like trainers are best. Carry your inhaler and GTN spray and use them when you need to. If prescribed, use oxygen at your regular setting when exercising. And above all, listen to your body. When you are having an off day, rest and do not push yourself until you are feeling better. You'll make better progress when you are feeling well and prepared. The UK Physical Activity Guidelines for adults and older adults are there to guide us. We should be aiming for 150 minutes of moderate activity or 75 minutes of vigorous activity each week to maintain our overall health and well-being. This can be broken down into small manageable pieces, such as 30 minutes 5 times a week or 20 minutes daily. It is important to remember that moderate and vigorous mean different things to each person, and whatever the activity, as long as your breathing is around 3 on the Borg scale, that is moderate to you. Even small changes can make a big difference over time, but the message is clear that we need to move more and minimise our time sat down. Exercise and physical activity has to become part of our everyday life. The ultimate goal after pulmonary rehab is to help you develop an exercise for life mentality. Once the course is finished, it is very important to maintain your progress, and a member of staff can talk to you to determine how to do this in the best way for you. Thank you for watching this short film. We look forward to seeing you on our pulmonary rehab programme and to helping you achieve your goals.